What's going on, everybody? Dr. Michael Sclafani here, owner of Tideline Sports Performance and Rehabilitation. And today we're going to be talking about active versus passive mobility. So these are two concepts that a lot of people seem to blend together. And I think, in all honesty, I think there's an over-reliance on passive mobility. So let's dive into what each of these mean, and then we can also see which one may be best for you where you are in your fitness journey. So let's start off with passive mobility. So passive mobility occurs when we increase the motion of a particular segment or a joint or a muscle through some external force. So for example, let's say that I grab my heel and I do a quad stretch. Well, that's the external force of my arm pulling my heel towards my buttock to help to stretch out my quad. Maybe I drop my heel off the edge of a step. Now I'm using gravity, another external force, to then apply an even greater stretch. Maybe I grab one of these mobility bands that we have in clinic, or maybe that you have in your gym, and then now I'm pulling on that band as I go into a hamstring stretch. Now I'm applying the external force of the mobility band on my hamstring muscle to apply that passive mobility. The other way that we can describe passive mobility is if we use a friend. So let's say you go see a massage therapist and they're actually digging into some of the muscles and things like that. That would be the use of an external force, which is their hands, to improve any of the mobility or range of motion. The other thing that we have are things like cupping and dry needling, or maybe you go to see a chiropractor or one of our guys and they crack your back, right? Now you're using a friend to help induce mobility or induce motion. Now, this differs a little bit more than active mobility. When we were looking at passive mobility, you're just kind of hanging on a particular muscle or a joint, and you're just kind of a wet noodle or just a floppy noodle while you're hanging out there. With something like active mobility, now instead of using an external force, the force is actually coming from within you. So that's why we term it as active mobility. You are in control of the mobility, the range of motion, and things like that. So what does that look like? Let's say you have tight hamstrings. Maybe we're doing something like an RDL or some type of hinge maneuver then to slowly control the movement and do a lengthened hamstring position on our own control. Now, maybe we have really tight knees or stiff knees and we're trying to improve the mobility of our quad. Well, now what we're doing is we can actively go through the descent or the lowering portion of your squat to help to control that. Now we're using our own body's internal mechanism to help us control a particular movement and to improve your mobility. So let's take a step back and let's talk about a little bit of the physiology behind both passive mobility and active mobility. Inside of our muscle fibers, there's something called muscle spindles. And these are small nerve receptors, and they're responsible for that elastic recoil or stretch that occurs to a muscle. Let's say that I'm walking along the street, somebody grabs my arm and pulls. The first thing that I'm going to do is I'm going to recoil back to the center of my body. That's due to a reflex that's induced by our muscle spindles. If we do something like a very ballistic stretch, maybe I'm getting ready to do a heavy squat, or I'm going to do a bunch of squats in a row, and I want to warm up my quad muscle. If I just keep pulling on my heel to try to really pull on my quad muscle to help open it up, what that's going to do is that's going to activate those muscle spindle fibers, and that's actually going to cause me to recoil, and it's going to make your quad muscles actually feel tighter. The muscle spindle fibers, their main function is when we get into the concept of what we call plyometrics, which a lot of people think of as jumping or impact activities. If we think about, say, doing a max vertical jump, you're going to get a lot more height when you go into a small squat and then you jump up, versus if you just stand still and try to jump as high as you can from a perfectly upright position, you're probably not going to make it as far. The reason why we get a lot more height when we bend our knees and go into a small counter movement squat is because we activate those muscle spindle fibers that are responsible for kind of pulling back on a slingshot and allowing an increased power production. So muscle spindles have their point, but when we talk about mobility, and range of motion and trying to help you guys improve some of your flexibility and some of those other key areas that are going to be important for your fitness journey, we don't really want to rely on muscle spindles to do the job. And unfortunately, a lot of times with passive mobility, we rely too much on the muscle spindle activity. If we move to the next concept, and that next concept is the elastic mobility of our muscle fibers, right? So in essence, our muscles are kind of like big rubber bands, right? They respond to a stretch, they recoil, like we just talked about with muscle spindles. However, if all you do is keep cranking on them and you keep stretching them, especially to their maximal capacity, what's going to happen is over time, they're going to lose their recoil and they're just going to become like a big wet noodle. We see this with things like regular rubber bands in your home, especially with hair ties, right? How many women walk around with hair ties around their wrist and they have a bad habit of playing with it, pulling on it? Well, what happens? Eventually, you lose that snappiness, you lose that springiness. When we're talking about muscles, that's actually not a good thing, right? Muscles provide a lot of power, a lot of strength, a lot of force development. If we don't have that elasticity, what have we done? We've weakened that muscle. The reason that this can be really problematic is not just for your performance, but it can also affect your injury risk as well. If you're sitting there and you're cranking on your quad muscles so much that your quad muscles lose some of their efficiency, some of their power, and then you get underneath a heavy back squat, well, guess what? If you don't have a lot of power coming from your quads, you may end up compensating through your lower back, and then you may hurt your lower back and then have to come see one of our guys. So what we're trying to do is make sure that we kind of are able to differentiate what is important inside of the muscle cell and how you can use some of this physiology to your advantage. So let's break this back down into active versus passive mobility, right? What we want to do is we are trying to induce more active mobility. Active mobility typically is going to be done through the eccentric or the descent of a particular movement. Some people will call it the negative as well. We talked a little bit about this in what creates some of the muscle soreness in our first video. And yes, eccentrics can make some of your muscles a little bit more sore, but it's vital that we are able to induce that mobility through that eccentric contraction to make sure that we decrease our risk for injury and improve our performance, which is our main goal. And that's gonna make you a longer lasting fitness individual, and you'll be able to go further on your fitness journey. So what does this actually look like, right? So let's say that my hamstrings are really tight, and I know that I'm gonna be doing something like deadlifts, but I don't wanna hurt my back because of how tight my hamstrings are, right? So what am I gonna do? Rather than sit there and try to passively stretch out my hamstrings, maybe I just put one foot forward, lean through, and try to just basically crank on that hamstring muscle. Probably not the best strategy. I'm going to lose a lot of power development in my hamstrings when I go to deadlift. Could put an increased pressure on my lower back. Instead, what I'm going to do is while I'm warming up for my deadlifts, I'm going to actually go into a hinge position and do something like Romanian deadlifts or RDLs. Nate and John are going to go through several of these movements with you as well. So don't worry if some of those terms sound a little unfamiliar. No problem. They'll help you out with that. The other thing, let's say that your shoulders feel really tight, but we're getting ready to do something like a dumbbell press or a barbell overhead press, and you're worried that you may not have enough mobility to get over. Well, rather than sitting there and going up against the rig or going up against a wall and just leaning forward and trying to passively stretch out your shoulders, what if we activate more of the eccentric or the descending component of that? If you go over to a bar or a rig and you do a pull-up, and then you slowly lower yourself down, you can actually improve the mobility of your lats and some of the other surrounding shoulder musculature to make sure that you're able to fully get overhead without any issues at all when you get ready to do your overhead press movements. So while massage, dry needling, and some of those other interventions are really great tools that will help you with your recovery, they may not be the best strategy when we start talking about long-term mobility gains, right? Something like massage, dry needling, they can help you unlock temporarily certain aspects of your mobility, But what we don't want is for you to get a massage or to do something like dry needling, or maybe foam roll or use a lacrosse ball and have this temporary improvement in mobility and then go out and do your physical activity, and then now that muscle isn't able to perform as well. That'll increase your risk for injury. Instead, what we need to do is we can use massage and dry needling to help to unlock certain aspects of your mobility, but then what we need to do is we need to control that mobility. Once you open up that new mobility, we need to regain the ability to utilize that to our advantage. We have a saying in our sports medicine world that new range of motion is weak range of motion. So once you improve your mobility, we need to make sure that you're strong enough to be able to control that, especially when you do something like lift weights or even move your own body weight. So the best strategy would be to find certain elements and certain movements that are going to help to actively improve your mobility. If you guys need some suggestions, reach out to us and we're more than happy to take a look at you. We're more than happy to answer any questions, help you out to make sure that you have a great fitness journey and that you decrease your risk of injury and you're not just so over-reliant on some passive mobility. Now, one quick caveat is that there is some mixed evidence about in a cool down or post-workout, passive mobility may have its place. So let's say that you just finished a really hard workout. Maybe you just did a bunch of squats. You can do some very, very light, gentle quad stretches, hamstring stretches, holding for 3 to 5 seconds, just to kind of help your body down regulate or just change gears so that you're not in that heightened state. That is a really great use of something like passive mobility. But I would not be able to sit up here and say, hey, if you stretch out your hamstrings by just kicking one foot forward and then leaning your trunk forward, that's going to make your hamstrings more mobile before you start doing something like a deadlift. That's not really how it works. So instead, ditch some of the stretches, ditch some of those passive interventions before you work out, and really try to find some great ways to focus more on active mobility, or we just term movement primers, or just simply activation. Hopefully this helps you guys out. If you have any questions at all, or you need anything from us, please don't hesitate to reach out, and we'll be more than happy to answer any questions you guys have.